As the measles epidemic grows, the CDC is also warning about another potentially deadly childhood disease. It was almost eliminated in the mid-90s, whooping cough. It's caused by an extremely contagious bacteria that can lead to severe respiratory infections, including pneumonia. Public health officials say whooping cough cases are soaring across Europe, Asia, and parts of the U.S. For example, in Northern California, CDC says so far this year there have been more cases than in 2012. That year, there were nearly 49,000 cases nationwide, the highest this century. Officials also say, as with the current measles outbreak, international travelers could bring more cases here. So what are the symptoms of whooping cough? At first, it seems like a normal cold. Symptoms start with a runny or stuffed nose, low-grade fever, and coughing. Those coughs gradually get worse over a week or two and turn into violent coughing fits that can lead to vomiting and make it difficult to breathe. It's important to note many babies don't cough. Instead, they may turn blue and struggle to breathe. They may have those common cold symptoms the entire illness, which can last as long as 12 weeks. Pertussis is usually treated with antibiotics. Doctors say it's important to treat whooping cough early before the telltale coughs start. Early treatment can make those fits much less serious and prevent spreading the bacteria. About a third of babies younger than 1 year old who get whooping cough need care in the hospital. CDC says the best way to prevent it is to get vaccinated. It's recommended infants get their first dose of the vaccine at 2 months. They'll need a booster at about 4 months and again at about 15 months, and 4 to 6 years of age.